Hello, and thanks for stopping by. If you haven't looked at any of my videos, my name is Douglas Deutschman. I'm a professor of biology and statistics. I've been teaching biostatistics to graduate students for 30 years. I've been following and modeling some of the data from the COVID-19 outbreak for about 6-7 weeks now, since early February. Today I'll be talking about the forecast for growth of new cases in the states, and really highlighting not only the states that we know are already very bad, like New York, but the states that are getting bad very quickly that maybe aren't yet in the headlines. So in my video a couple days ago, I posted the map of the COVID-19 cases in red at the bottom against the night sky at the top from satellite imagery, and they matched almost perfectly. They still match, but there's a difference. The difference is that we're starting to fill in around these light centers, these urban centers that are very bright. So that suggests that the virus is spreading out from the urban centers where it first was able to spread rapidly and into the suburban areas and maybe even exurban areas around there. Almost hit the wrong key because it doesn't do anything. New York Times this morning, about 3 hours ago, more than 2,100 people have died in the States. Now on the Johns Hopkins dashboard that I use for my graphics, they actually have deaths in the U.S. by region, by county, and so you don't see the full U.S. total. But when you put 2,100 on the map, we're now just behind France and Iran and Hubei, actually, and I think over the next day or two we'll pass those two, and probably within 4 or 5 days, maybe a week, we will be number one, not only in the number of cases worldwide, but in the number of fatalities. Not a distinction we would, of course, wanted. This is the map from this morning's New York Times data as well. So the data is current as of last night, probably March 28th, late, early. This is the morning on the 29th. We had originally seen infections really spreading on the West Coast, initially around Seattle and Oakland and LA. We also have significant numbers of cases in Chicago and Detroit, down in Atlanta. We have in New Orleans and in Miami-Dade, Broward County, Palm Beach County in Florida. But the big story is the northeastern corridor. We know that New York and New Jersey are bad. They're getting all the headlines. But what we're going to find, I think, in the next few days is that the entire northeast corridor from D.C. to Boston is just going to fill in as one ginormous red blob of pain. So a couple things from today's news. Trump yesterday had been talking about quarantining parts of New Jersey and New York as hotspots. I think there's some very interesting and troublesome questions there about what quarantine means and what a hotspot is and what the intended public health benefit is when we have essentially a hotspot that is the entire northeastern portion of the United States. From the world's perspective, the hotspot in the world is the U.S., and that's appropriate. The death toll worldwide is now over 30,000. We passed 25,000, I think, only yesterday. And this thing about Amazon enticing employees with higher pay, I kept on here because many of us are under shelter-in-place orders, and we need to stay off the roads. We need to stay out of the stores as much as possible. We need to have the fewest people interacting as we possibly can. We need to keep out of the way so first responders, health professionals can do their job. We don't want to make it worse for them. And we need to let folks that are involved in logistics, medical equipment, food, essential infrastructure to do their job. The rest of us should just stay out of the way. This was going to be today's top 10, but apparently I can't count because I have the top 9. So in terms of the population, the number of reported cases, remember that's important because these are the cases that are reported, and we know that we're not testing everyone. The highest state is the state of New York. What you're looking at in these bottom 2 rows is the difference in the top row. So this is just subtraction. So if we have 53 on the 28th and we had 25,000 on the 24th, we've added 27,000 and change, right? This gold color is supposed to be a color ramp from low to high, but what you see is really one gold cell, one slightly yellow cell, and everything else is small in comparison. That tells us that in terms of raw numbers, the 2 states that have added the most is New York and New Jersey, and by far it's New York. It's a different story, though, when you look at percentage growth rate, and that's important because that's telling us who's going to be big tomorrow. We know New York and New Jersey are already bad, but for example, Massachusetts only had 1,100 cases 4 days ago, and now they have over 4,000. So they've added 267% new cases. So that's more than threefold growth, 3.5-fold. We're seeing tremendous growth. I mean, New York is doubling, but New Jersey's tripling, and Massachusetts is almost quadrupling. So it's really important to keep track of the growth rate, because that's going to help us anticipate where things are getting worse. On the 24th, I made predictions for all the states, and I graphed some of the predictions to show sort of different models you can use. And I'm just showing you some of these to give you a sense of where I've been right and where I've been wrong, and what I think the quality of my statements are today about the counties and the states that are really going to be in trouble soon. California was at 2,500. It's now at 5,400. I predicted on this red line, and I talk about this in my previous video, 6,053 would have been the number for the 28th. So that's actually very close. And since we're modeling in a log 10 scale because of the nature of epidemic growth, I just wanted to point out that the log 10 value for this is 3.73 versus 3.78. So they are very close together in this log 10 framework, and that just it's important to recognize how the error bars change as you get bigger. Washington had 2,800, so more than California, but was growing more slowly. I predicted 5,200. They're at 4,300. That's 3.63 versus 3.7. Again, very close. And New Jersey had 2,844. No, it didn't. It must have been something different, because those two numbers shouldn't be the same. That's a copy-paste error. But it's grown to 11,124. And that's something I predicted would have been closer to 24,000. So the real value of the dot is below my star. It actually doesn't look that dramatic, because that's a 4.0 versus a 4.4 in this log 10 metric. But you can see already on this thing, I talked about this on my previous video, some of the states have these very erratic patterns that suggest delays or clusters of reporting issues where it's flat and then it jumps, and it's flat and it jumps. And fitting a line to that's very difficult, because we need to decide which of those data are most accurate. If we look at New York and Michigan, let me start with Michigan. Michigan had this phenomenal growth rate last time. And Michigan also had the same issue with cases jumping on a few different days. And if you try to create a line through those, you see a prediction that is really quite dramatically fast. I also said at the time I'm fitting a quadratic model that allows for deceleration or acceleration. And I said that the deceleration model actually probably made sense, because this was probably partly an artifact of them starting to test a lot when they realized the cases were getting bad. So if we didn't decelerate, we would have predicted it would have gone from 2,000 to 30,000, which is pretty impossible. Well, that's not impossible. I take it back. It's pretty astonishing. They're at 4,635 right now. So they're really more along this trajectory that when I refit the model for another video, you'll see it'll be much more stable. New York was growing very quickly, but also had some wiggles having to do with a jump in reporting. I predicted, based on the exponential growth we were seeing across a week-long period, we'd see 151,000 cases. We've got 53,000 reported cases. I think that if we're adding 100,000 cases in 4 days, there's no way we can test them all and keep track of them. So I think it's actually closer to my estimate than this number reflects. So it's hard to know. Some scientists are suggesting that we model fatalities as a more reliable indicator of the nature of the spread. That's a great idea if you want to be accurate. It's a terrible idea if you want to be proactive, because deaths lag 10 or 14 or 20 days behind cases because of the nature of how the disease incubates and how the progression of the disease goes. And so it may be accurate, but it's too late by that point. So on the 23rd, I plotted the number of cases on a log scale against the percentage growth on a linear scale, and I said the sort of top right is bad, because it either means you have a lot of cases or a high growth rate, kind of both. So New York had the highest number of cases and a pretty fast growth rate. Michigan had the weirdest highest growth rate of over 70% per day, and we've seen that hasn't been sustained. This is the same graph from today. The scale has changed a little bit. Mostly, we don't have an 80% growth rate as a max. We're really maxing at around 45%, which is probably realistic. And we have some growing as low as 10 or 15%. And I'm going to actually decorate this with some color to try to show you what I think are some of the patterns that are really important to talk about. First of all, West Virginia, I got nothing. It had 100 cases, or it has 100 cases, and has this phenomenal growth rate. So they must have just gone from a few to 100, just basically overnight. And again, I suspect that's a reporting and testing issue. But we'll start with the red. These are the three areas where we're really already in deep trouble. New York, we know about 50,000 cases, growing at 40%. New Jersey, 11,000 cases, growing at 40%. Michigan only at 4,000-ish cases, growing at 45-ish%. So Michigan's going to be gaining on New Jersey and New York. Contrast that to California and Washington, which also had, with Michigan, 4,000 cases a couple days ago, and they're at growing at 15-20%, so that they are dropping out of the top 5, and Washington will drop out of the top 10, I think, in the next day or two, and I think California will soon follow it, and they'll be replaced by states like Pennsylvania and Massachusetts, and Arizona, I think, and Indiana, and I'll explain why when we get to the map. So without further ado, what I've done is I've mapped onto this map from the New York Times, the states that I've outlined in red, orange, and green. Let's do with the green first. That's not what you're supposed to do with the green. You're supposed to do the green here and circle, not click. Okay, California, Washington had a lot of cases very early on, so they still have a fair number. And these circles are not about growth rate, they're about number of cases. So they reflect history. Over here we have this sort of large set of circles having to do with New York and New Jersey. So New York, New Jersey is the epicenter of the really significant problem in the U.S. Michigan is a sort of a secondary epicenter. But what we're seeing is that we're getting very high growth rate. So these orange things are to the left of the red things. And you can see have fewer cases today. But these ones up here are actually growing faster than New Jersey and New York, and these are growing almost as fast. So the ones that are in this sort of band, and there's no magic between where you stop. Tennessee is very close to this, and Ohio's in and Tennessee's out in the way I've colored it. There's no magic there. It's just me looking at the numbers and seeing what I think is a sensible cutoff. Things down here are states that have few numbers and are growing slowly: New Hampshire, Maine, Wyoming, Nebraska, etc. And then, as I pointed out here, the green one. So we have Pennsylvania, Connecticut, and Massachusetts. And I've looked at the county maps, and so for Massachusetts, it's Middlesex and Suffolk County. It's the Boston area. Let's see, Connecticut, it's Fairfield County for the most part. New Jersey, I don't think I looked at New Jersey, but it's much of, there's two areas of New Jersey, right? There's the area up by New York and the area down by Philadelphia, and it's the whole state's, I think, going to be impacted. Pennsylvania, it's the counties clustered around Philadelphia. So that's Philly, and that's Montgomery County, and Delaware County, I think it is. So those are the first, third, and fifth most populous counties in the state. West Virginia, I got nothing. Ohio is dominated by Cuyahoga County. That's where Cleveland is. So, Cindy, Mary, if you're listening, that's my sister and my stepmom. It's time to start really staying home, because Cuyahoga County is taking off, and Ohio is fast becoming a problem, and it's mostly in your area. So I'm really worried about you. Illinois, Chicago is growing quite a bit. Indiana, I thought was going to be the portion up, Gary, Indiana, Gary, Indiana. Old people will know what that is. Near Chicago, but that's not true. It's Indianapolis. Indianapolis is really growing quite quickly. Fulton County, Georgia, I believe that's the right county. I'm getting my names mixed up, but that's Atlanta. Georgia is growing very quickly. I said Broward, Palm Beach, Miami-Dade, growing very quickly in Florida. Louisiana, it's the area around New Orleans. Missouri, it's St. Louis. I don't think I looked up Texas, but it's Houston and Dallas, I'm fairly certain. Forgot to look up Mississippi. What was I thinking? Colorado, we know it's Denver. Arizona's Maricopa County, that's Phoenix. So Phoenix is growing very, very rapidly. It's a very dense area. So I think Phoenix, which also has a lot of retirees like Southern Florida, is going to see phenomenal death rates, unfortunately, because they have a very susceptible population, a very large population, and it's growing quickly. So in terms of fatalities, Arizona and Florida are going to be really, I think, big epicenters of high rates of mortality, unfortunately. Michigan is really a huge problem right now. It's centered on Wayne County and Oakland County. It's the areas right around Detroit. And I've been trying to figure out why that might be the case. I have a hypothesis. It's just a hypothesis, so it might not be right. But I think from my visit travels through Detroit, I think there's a fairly large sort of Persian Iranian population in Detroit. So I think there might have been a lot of travel between Iran and Detroit. And remember, Iran and Italy were the two countries that had the greatest epidemics after China, and Iran really didn't acknowledge or deal with their epidemic for the first week or 10 days because of a number of religious and political things that were going on. So I think there was a period of time when it was becoming really prevalent, but it wasn't really well known. And there was a lot of travel between the countries at that point. Michigan might have been the place that those cases tended to come to rest. But the big signal is the Northeast corridor. What we're seeing in New York and New Jersey is a preview of what will be everything from Boston to DC in just a few days. So we're going to go through Boston, through Connecticut, New Jersey, all of New Jersey, the parts of New York, the 5 boroughs in the area around Long Island, Pennsylvania, the eastern part of Pennsylvania. There's probably a little stuff going on in Pittsburgh too because it's a big city, but really the ginormous number of cases, scientific word there, ginormous, is the eastern part of Pennsylvania where it butts up into the Delaware River and New Jersey and New York and all that fun stuff. And that means that Delaware and Maryland and part of Virginia and Washington, D.C. are also going to be filling in. So areas to watch out for: Chicago, Indianapolis, Cleveland, Atlanta, New Orleans, St. Louis, Southern Florida, Phoenix. And so I think that what we'll see in 3 or 5 days is the coverage is not just, well, the coverage might still be the Northeast because it's going to be dreadful, but there's going to be other cities that are in quite bad shape. Surgeon General, I think this was 5 days ago, said this week it's going to get bad, and he was exactly right, and I'm glad he spoke up. And he said we have very little time to slow the spread. I think we're already out of time for many places like New York, because we're seeing now the cases that were infections from 5 or 7 or 10 days ago that are now becoming the disease in terms of symptoms. So we know we still have, if we stopped all spread today magically, we would still see case growth for another week or 2 weeks. So we're already in trouble that way. But I wanted to just drive this home to you. So the first World Health Organization report came out, their situation report, I think it was January 20th or 21st. So on the 23rd of March, 6 days ago, I clipped the Johns Hopkins dashboard, and there were 350,000 cases worldwide. China had about 80,000 in its outbreak, so we had already quadrupled China. But it took 63 days to get from January 21st to March 23rd, and we had 350,000 cases accumulate. Now, some of those cases were accumulating before that in Hubei and in Wuhan, but that doesn't change the math much. Now, 6 days later, we're at 679,000, 680,000 already. I checked, I just haven't uploaded the new image from a few minutes ago. So we're basically, 700,000 is basically doubling. So we doubled our 350,000 cases in 6 days. So we're adding an average of 50 or 60,000 cases a day, and it's accelerating. So we won't take 6 days to double again. It'll take less, maybe 5, maybe 4. So if we're lucky, it's 5 days, and we'll have 1.3-ish million people in 5 days. So yeah, we'll be over 1 million for April Fool's Day. It'll be terrible. The Surgeon General in his warning said we're not going to ventilator our way out of this problem. That's the take-home message. This is not something we're going to solve by treating cases. We're already in way over our head for that. We have to keep it from getting worse. So the take-home message for you is, especially if you're in Phoenix or Indianapolis or St. Louis or some of the places that haven't gotten as much attention in the news, Detroit certainly, stay home, interact with as few people as possible, order in or go pick up, once a day, go somewhere, wipe off containers when you bring them in the house. Really don't, you go walking for exercise, sure, alone or with your family. Don't go with your neighbor. Right? You don't want to be going with anyone that you're not already dealing with on a daily basis. I have a sister-in-law in Paris, outside of Paris, and in France they are allowed to go out once a day for an hour. They can exercise if they're within a kilometer of their house. They can go to one store. They have to carry a piece of paper that documents the time they're leaving their house and what their thing is. They will get stopped and checked. That's how serious they're taking it. If you're driving, you're going to be the only car on the road. They will pull you over and ask what you're doing. And again, if you're a health professional or a first responder, or you're keeping the lights on at a power plant, they're going to say thank you. And if you're not, they're going to say, what are you doing? And in Italy, I've been told that they're fining people and even jailing people who knowingly have the virus and are violating quarantine orders. I would love to see $1,000 fines for people that have the disease who don't stay home like they're supposed to. Maybe even 5,000, because they're going to kill people. Not directly, not with a knife, but we have to stop this, because it's not just me or you. If I get the disease and I die, that's tragedy for me and my family, but that's just me. But if I have the disease and I go wandering around, I may spread it to 20 people, who may spread it to 40 other people, who may spread it to 100 other people, and maybe 8 or 10 other people will die because of me. That's on me. I don't want that. I don't want you to have that on your head either. So the way we're going to help this is we're all going to slow this down. I wish I had uplifting news for our Sunday morning, but it's sobering news. It's not unexpected, but really it's going to get really tedious being in our houses, getting cranky with our children or our spouses, or lonely, or getting sick of binge watching Netflix. It's going to get ugly. In Hubei, it was 9 weeks before they had started to ease up on the lockdown. We may be looking at 6, 8, 10 weeks in some places if we're really going to slow this thing down. So don't lose your resolve. We need to treat this seriously. That's all. That's the take-home message. And I told you some places where you need to do it more quickly than others. If you're in rural Idaho, it's probably not as bad to go out and talk to people. I mean, it's still going to spread the disease. It's already there. Don't do it. But places you really need to be careful: Cleveland, St. Louis, Phoenix, Atlanta, southern Florida. Anything on the northeast corridor. I use the railway from Washington to Boston to kind of map out where that sort of megalopolis is just going to fill in with cases. So now I'm just rambling on about how bad I think it's going to get in a few days. Not cheery, but I think true. So sobering. Pay attention. Do your part. Do your part. I'm trying to do my part. Bye.